drop. Good. There we go. Here's a little one. And let's try higher up as well. Drop, drop. There we go. Saw relaxed that time. Went for it. Well done. Just take a breath in for me. All the way out. Nice. In. All the way out. Breath in. All the way out. Yep. Little one there. Breath in for me. All the way out. Wow.
Yeah.
Okay. Wow. It's gonna come up. Hips towards me, please. Awesome. Breath in. All the way out. Nancy.
Hi.
Thanks for coming in today. Good to see you again. It's been about a week. But
Thanks for having me.
what I'm gonna let Nancy's a student. Okay, she's a chiropractic intern, and I've already made a video on this channel about just how intensive that curriculum is. So she's in her clinical internship year. Congratulations, you've almost made it.
Almost.
Almost, so close there. But she's in today just kind of looking to get a regular treatment session, and I'm going to let her kind of talk about it a little bit. So Nancy, why don't you go ahead?
So just like usual student pain, I feel like I'm studying a lot. I'm sitting at a desk, I'm doing the hunched over, I'm doing the sitting weird.
Yeah.
I think I'm doing a lot of like forward flexion of the neck. It's been causing some neck pain, some upper neck pain, and then typically I'd get like an associated headache, and then it's kind of when I just get my neck treated that it goes away and it's relieved, and then it goes away for a period of time, then it'll come back when I'm doing some more intense studying.
Okay.
And then same thing with the low back, just the stiffness.
Same concept of like you're sitting too long, it kind of weighs on you,
Yeah.
and then you kind of get treated and everything resolves. It does come back, but it improves temporarily,
Correct.
right? So it sounds like to me that Nancy's one of those people who would benefit strongly from the concept of wellness care. Some people look a little bit weird at that, but there are people who do have merit in seeing a chiro or a massage therapist or a physiotherapist or some kind of manual therapist intermittently to keep these complaints at bay, right? You shouldn't keep the patient coming back to you with a very high intense frequency. At that rate, what are you really doing for them? But if you're able to space it out so that they can live their lives largely and only come in every now and again, that to me seems like a success case. So I'm aware that that's a subjective piece, but that's my definition of a successful case. So we talked about the neck, upper back student. Again, the CMCC program, the chiropractic program, it is a doctorate program, very, very intensive, very high stress. Almost at the end of it, so hopefully some of these symptoms will relieve when you don't have to sit at a desk hunched over studying. You're going to have to do soap notes. But yeah, any other thoughts? Or is it really just kind of that wellness you're in for today?
I think you got it.
Okay, crushed it. All right, so what we're going to do today is we're going to do a re-examination. We're going to do a physical exam, and then we're going to get into treatment. Okay, awesome. All right, so Nancy's primary complaint is that associated neck tightness that comes on with the classic upper cross syndrome or that student syndrome for studying for too long. So we're going to do a neck range of motion exam at minimum to start here. So we'll get you to bring your chin down to your chest for me. And any kind of discomfort or stiffness provoked in the back of the neck here? No? Okay, now what if I do something mean and I actually push you down further? Still okay, or are we getting some kind of aggravation?
A little bit, just
on kind of the right side a little bit?
Yeah.
Okay, you can come back up. I want you to look up to the ceiling for me. Anything in the neck with that? Or no? Okay, and get the hair out of the eyes. Anything as I pull further?
No.
Oh, okay, good. Tilt right ear to right shoulder, please. And just left to left. It's always a little harder to see the range of motion when people got curly hair, but I'll get you to rotate your head as far as you can to the right, please. We can get to about 80 degrees, good, and other side. We can get to about 45, so there is an asymmetry in this case to the left side, less rotation. I'll get you to stand up for me real quick. Bend down, touch your toes for me. Any kind of lower back discomfort with that or no?
Just the stretching.
Just a stretch along kind of both sides there, not the right or the left, both?
Both.
Good. All right, come back up. Go the other way for me. Extend backward, yes. Any discomfort in the low back with that?
There's actually something right there.
Yeah, okay, so again, she's pointing to that TL region that we see way too often on the channel there, where the thoracic spine becomes the lumbar spine, site of high stress and shear and force. Good. You can have another seat for me, please. I'll get you to bring both arms up for me. Keep them there, okay? Don't let me move them. Good. Good. I'm going to tilt the camera just a little bit for this one. Good. Arms forward, curl the wrists backward, please. Good. That is a large rock. Turn over. Good. Fingers, please. Curl. Good. Don't want to, those are nice nails too. I don't want to ruin them. and then turn over and squeeze. Good. All right. You can relax your arms. Missed. Here we go. Good. Drop that arm. Drop, drop. Good.
Good one.
Thank you. Not my first time doing this. Not my last time either. Drop, drop. Good. I'm out of the way somewhat. Good. Awesome. All right. You said that you're mostly getting it.
Yeah, I feel that.
You feel that there. Both sides? There's a worse on one side.
Worse on the right.
Worse on the right side. Okay. Are you left or right-handed?
Right.
Okay. Okay, my hand's gonna go on your front hip. Oh, freebie.
I told you.
Yeah. Wasn't even trying. Well, right side didn't pop as easily.
Mm-hmm.
That's okay. We'll get that in a few minutes, okay?
Yeah.
How'd that happen? Anyways, yeah, so Nancy, that actually just went.
Yeah, it did.
Okay, so we're actually going to start with this side. You really do. Okay.
Yeah, that side is tender.
Is it usually your left side or more so
My
your
left
right?
side is usually tighter.
Got it. Drop, 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 drop. Good. Worse as we get lower down. Yikes. Turn as far as you can to the right for me. Good. And drop that head. Okay, pretend my hand is a pillow. Pretend the hand's a pillow. There we go. So you'll know that she's relaxed when you see this SCM muscle shut off. And that's when she lets me actually support her head. So once again, pillow. Think pillow. Ah, you're having troubles with this, aren't you?
It never turns off.
Really? Okay. It did for a second there. All right. Drop, drop, drop. Good. There we go. Here's a little one. And let's try higher up as well. Drop, drop. There we go. Saw relax that time, went for it. Well done. Bring this over. take a breath in for me. All the way out. Nice. In. All the way out. You really are a glow stick up here. I think I could have actually sneezed on you and that all would have gone down. See if there's something here. Okay, I'm gonna kind of grip your head here. Breath in, all the way out. Yep, little one there. Good. That side actually feels okay to me. Good. All right, we're gonna bring this probably. Yeah. If you release as easily as you say you do, squish the hips a little closer. Perfect. Thank you. And good. Breath in for me, all the way out. Wow.
Yeah.
Okay. Wow. That was a huge release. Okay. You were also mentioning that you do get tightness up that TL, so let's do a Banyan as well. So put that hand in the armpit for me. Perfect. I'm gonna snake under here. Good. And breath in, all the way out. There we go. There's one hidden one there. Okay. We'll get you on the other side, please. Arms gonna come up, hips towards me, please. Awesome. Okay. And breath in, all the way out. Take two. Okay, so Nancy, as I mentioned at the start of this video, is a chiropractic intern. Now what that means is that she's in her 4th year of chiro school following her undergraduate degree, or early acceptance rather, 3 years. But a question that I want to ask her is what kind of drew her to the chiropractic field in the first place? So, Nancy?
I think initially I was just really interested in manual therapy. I just was really gravitating towards the types of treatments, like the soft tissue therapy, the SMT, the adjusting, and all of that. I wanted to work with my hands, and I wanted to be in healthcare. And then doing my internship at the hospital, I think I really got to see how it impacts people's lives, and I think that really kind of supported exactly why I came into the profession in the first place. I think that a lot of things in people's lives are uncontrollable. I think people go through a lot of things and they don't realize how much of an impact it has on their musculoskeletal health. A lot of mental health concerns, a lot of just day-to-day activities impacting people, a lot of comorbidities, a lot of things that people go through in the healthcare system. I think that there's a lot of things that people can't control, and a lot of the things that we do is helping people get that autonomy and educate them on ways that they can deal with their pain, their physical pain. And I just think that it's so empowering to the patient, and also you see the difference in their day-to-day lives when they can get up to go to work, or they can see their grandkids, or they can do just general activities that people take for granted.
That was very eloquently put. Better answer than I was expecting. Not that I was expecting a bad one per se, but well done.
Yeah.
I'd have to agree with you. My rationale for getting into chiro school wasn't a great one. It was a 4-year program. I didn't want to move back home yet, but I'm quite happy that I did this. It'd be a very expensive mistake had I not ended up enjoying it at the end. But it is quite rewarding when somebody comes in and thanks you for helping them achieve whatever their goal was. Whether, at least in my case, I see a lot of weight trainers, so it's usually like, oh, you helped me bench 315. It's like, no problem, buddy. But then I do have some others who it's like, I got to pick up my grandson. Yeah. Right? It's like, it's heartwarming in a way that I wasn't expecting when I first did that interview. So I'm happy you have a better answer than I probably do for it.
No, all answers are fair.
Most are valid, yes.
Yeah. And I think it's also about educating people about what chiropractic is and what we do. I think a lot of people aren't aware of the full scope of our practice, so it's nice to be able to inform people and show them all the different treatment techniques that we can do.
That's very, very correct. I have far too many patients who, when they're meeting me for the first time, think that crack, stack, and kick out of the room is about my business model. And no, there are some extra steps in there, thank you very much, one of which we're doing right now, but also it's just diversified technique, right? Acupuncture, modalities, exercise, lifestyle guidance, all that good stuff. Adjusting is a part of it, and granted, it's a really cool part of it, but it's not the only. you look up and to the right for me, please? Good. I'm going to take a pointy elbow. I'm going to put it right there. Now I'm going to slowly look down into the left. Okay, go ahead. And I don't want to pull your hair. That's just bad pain. So we'll move that out of the way. Okay, back up into the right. And down to the left. Good. Up to right. Down to left.
Oh, I'm not going to like this one.
Probably not. Surprised you like any of them, if I'm being honest. Up and to right. Down to left. People on the channel know that everybody I do this to, none of them like it, but they keep coming back for whatever reason. Haven't quite figured it out yet. Up to the right. Down to the left. That is a knot. Up to right. And down to left. Ooh. Okay, face forward. Tilt the right ear to your right shoulder, please. And left to left, slowly. Good, right to right. Left to left, slowly. Right to right. Left to left, slowly. Right to right. Left to left, slowly. Good. Would you look up and to the left, please? And down and to right. And up to left. Down to right. Up to left. Down to right. Up to left. Down to right. Ooh. One more up to left. Down to right. Face forward. Left to left. And right to right. Left to left. Right to right. Left to left. Right to right. And left to left. Right to right. Okay. Shrug the shoulders up for me and slowly lower. And up, slowly lower. And up, slowly lower. Fantastic job.
Amazing. That feels so good.
How you feeling now?
I feel amazing.
That's good. I'm happy to hear that.
Yeah, no complaints. No, but for real, like I could feel the muscle release while you were doing it, and just like.
Was that with the elbow or the tools or both or?
I think it was both.
Okay.
It was both. The elbow, like I could feel the pain, but like a good pain.
Yeah.
The tools felt like just like immediate release. I feel like
Nancy seems like she's a little lost for words right now. She was just saying that she feels like she could fall asleep after that. Very, very common reaction. When you are getting manually worked on, your body, you synthesize and you secrete all these endorphins, you get a rush, you get a sympathetic response, okay? And after that response, everything calms down, you feel de-stress, and with that can come feelings of sleepiness. So we see that here is what I'm kind of
I will be going to bed.
All right. Do you have any other questions, comments, concerns?
No, thank you.
No? All right. Well, thank you for coming in, Nancy.
Thanks.
Very much appreciated.
I'll come back.
Looking forward to it.
Don't forget to like, comment, and subscribe.
Thank you, Nancy.